and welcome back. Today I'm going to talk about bending of the knee after total knee replacement, something that we call flexion. Patients always ask me how far they'll be able to bend their knee after surgery, and it actually depends on a few factors. Most importantly is how much motion you have before knee replacement. If you have an extremely stiff knee, the tissue around your knee, the skin, the tendons, the muscles, are going to be quite tight. So even though the knee implant can bend back quite a ways, you may not be able to bend your knee back as far as someone that has full range of motion prior to surgery. Imagine wearing an extremely tight pair of jeans and trying to bend your knee back. That is some of the difficulties that you may have if you have a stiff knee before surgery, and one of the reasons your surgeon may prescribe physical therapy prior to surgery to try to get some more motion before the operation. Now, as far as the knee implant, most knee implants can bend back quite a ways, 130 degrees or more. So when you look at the actual implant itself, you can see there's a large curvature in the back that will allow the knee replacement part to bend quite a ways. If someone's large and overweight, sometimes the soft tissue in the back of the knee will be the main thing that prevents the knee from bending back further. But if somebody's knee before surgery only bent to here, even though the knee implant can bend back quite a ways, you may have a lot of difficulty with getting that tissue stretched out. Now, the other important factor after surgery is inflammation. So controlling inflammation with ice and anti-inflammatories will help. Imagine, for example, if you had a paper cut on your knuckle. You know that you didn't damage the inside joint, but that finger won't bend as far as the other ones for a while because the tissue is inflamed. After the knee replacement, that tissue is extremely inflamed around your knee. And as that inflammation subsides, you should start to see the range of motion improve. Now, the other important factor I tell a lot of patients, and what I think that they really need to understand, is you only get one chance. So if patients understand going in that they can't get motion after 6 or 8 or 10 months, that they really need to work harder in the beginning, I find that many of my patients will achieve that motion. Sometimes they'll focus on strengthening, thinking that strengthening is important, and it is, but you can always make your knee stronger down the road. So if you were going to work on one thing more importantly in the beginning, work on the bending. And one of the other simple things that I found that's been really helpful to help motivate my patients is a simple picture. This is something that you can ask your surgeon to do in the operating room. It's simple, it's quick, it's easy, and it's cheap. And all I do is take my phone, and after the surgery's done, what I'll do is I'll bend their knee up by lifting their leg up and letting gravity bend the knee. And then what I'll do is I'll snap a picture with my phone. I print that picture out for them the following morning just to let them know that their knee can bend back quite a ways, because I know in the back of their brain, when you bend it and it hurts, a lot of people are afraid that they might pop it out or open up the incision or that they're going to do some damage. And what I found over the years is seeing that picture that a lot of patients have that fear go away and are able to push a little bit harder with physical therapy in the beginning that prevents scar tissue, that gives them better motion in the long run, and makes them a happier total knee replacement at the end of the day. So I hope that information helps answer some of the questions about knee replacements and how much bend you can get or how much flexion you will get. And until next time, I'm Dr. Adam Rosen.